we have a real problem with alcohol harm here in Scotland, and it's not an exaggeration to say it's an emergency. Don't just take my word for that. The Scottish Government itself has described the crisis in alcohol harms, alcohol deaths, as a public health emergency. They said that more than 3 years ago, but still we lack a coherent strategy and sufficient action to get to grips with the problem. So there's a real need for a specific alcohol strategy covering all strands, prevention and treatment. The real big winners in the long term are the prevention strategies. We know what works from WHO evidence. We know that minimum unit pricing is helping. It's good that we increased from 50 pence to 65 pence last year, but we have to continue to do that on an annual basis. And we'd like an automatic uprating mechanism would be good. We have to do more work on the attractiveness of alcohol, that's restricting marketing. The Scottish Government have committed to consulting on that. I did consult on it last year and then rode back on that. So we need some more work on that. It's been a commitment for many years now, but we need to actually follow through. And the third strand in terms of prevention is the availability of alcohol. And that's largely to do with licensing. It's very hard to limit the number of outlets, but we know that's important because the number of alcohol outlets correlates very closely to the amount of local harm from alcohol. So at the very least, we'd like to see a ceiling put on no more alcohol outlets. In addition to these preventive strategies, we need to do a lot more to help people who actually are in trouble. There's been an alarming 40% reduction in people entering alcohol treatment services in the last decade, despite the fact the alcohol problem hasn't gone away. So we need to get better alcohol services, more alcohol services, easier access to alcohol services. And there's so much more that we could do.